Yo, 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 yo. This is Daily Med. Today we got some more info to give y'all, man. It might help save your life or the lives of a loved one. Today we rolling again. We're going to do prostate cancer. This is a disease, another cancer that's tearing our communities up on our loved ones, families, and friends. Doc finna break it down for y'all, and I'm gonna worry the hell out of them with crazy questions. Try not to curse as we go on. Uh, Go ahead, Doc, man. Take off, brother.
Hey, what's going on, everybody in COVID land? We are back. Yeah, we're doing our cancer series. And you're right, Nate. This is another cancer that affects a lot of people in our community, just at a disproportionate rate. So last time we talked about breast cancer and showing how there's a relation between um, being African American but having worse outcomes with breast cancer. So the equivalent for men is prostate cancer. Much like breast cancer is a sexual and a reproductive organ, the prostate is a what we call a genital sexual organ, important for life on this planet. Okay, this is how we reproduce. So that's why we have the parental advisory um, bar marker up there, just in case you got the ones and you don't want to hear about advanced anatomy about the pelvic region. Okay, so that's the fair warning now. Fair warning now. Okay, so prostate cancer. So it is undoubtedly the most common cancer in men. Most men have about a 12 to 15% shot of actually getting prostate cancer as long as you have a prostate. And it goes up as you age, the risk of it. About 8% of all prostate cancers are in people's 20s, and that's a weird, random situation. But usually it happens when you're in your 50s and beyond. And so it's something we definitely need to take a look at because yet again, it really does hit a lot of men. Now, the difference between prostate cancer and breast cancer is the fact that prostate cancer isn't as lethal in most cases compared to breast cancer. Okay. However, it does carry a high level of what we call morbidity with it as it goes on. And so, what I mean by morbidity is there's mortality, meaning if you're going to live or die from something, and morbidity means how bad you feel. Okay. And so, the prime example is if you stood in front of a train and the train is going max miles an hour, you're not going to feel that. You're going to instantly disintegrate, but you're definitely going to die. Okay. But you're not going to suffer. But if you said got 1,000 thumbtacks every day for several days before you died, that's a lot of morbidity. You are suffering a lot, just to give you a frame of reference. And so, what we need to start with, just like what we did with breast cancer, is what, Nate? What's the prostate? Okay. So, the prostate is a walnut sized gland that lies right under the bladder of a man. Okay. And it wraps around a tube called the ureter. The urethra is a tube that goes from the bladder through the penis and it lets out whatever is going to come out. 9 out of 10 times it's pee. Okay. Now, the purpose of the prostate being there is because it is the last stop for sperm before it is ejected out of the man. Okay. So men have testicles, men have testosterone. Testosterone is responsible for making sperm. Sperm gets created in a man's scrotal sac, travels, and loads up into the prostate. The prostate then creates seminal fluid. Okay. It's a combination of basic material, okay, things that have a high pH like baking soda, sugar, namely fruit sugar, some minerals like copper, zinc, selenium, things of that nature, and sperm. And then at the time of sexual intercourse and then ejaculation comes the ejaculate. Okay. Did that make sense, Nate? Nate, did that go over your head? Did that make sense?
Oh yeah.
And so it's extremely important for life. That fluid is what helps the sperm get to the egg and survive and get to the egg, and therefore you have more life on this planet. Okay. Now, Nate, just like in the last talk, there's a lot of similarities with breast cancer. One of the main things breasts have to deal with, more so than any other part of a woman's body, is constant hormonal influence, or it's wanting to receive hormones and it constantly has to deal with hormones. And so your prostate is the same way. It always deals with testosterone. It always deals with it from the day you are born. Okay, it is dealing with it at some level. And so this is one of the reasons why prostate cancer comes at a later age, is because it's decades and decades and decades of dealing with the byproducts of testosterone. Okay. Now, what's the problem with prostate cancer in the African American community? The problem being, when most men get diagnosed with prostate cancer, they will probably die of something else before that kills them within a 10-year span, or it's caught really early. With African Americans, African American men, we tend to actually die a little bit more than other groups from prostate cancer. And it's actually, a lot of times, it's usually caught at a later stage. So if you're a black male and you get diagnosed with prostate cancer, there's a higher chance of you actually having a more advanced disease than, say, other minority or majority groups, okay, in this country. And that's really disconcerting, because even some cases that are caught early, we're seeing more morbidity and a slightly higher mortality rate with African American men. And so they've dissected that a lot, and a lot of things come into play. So, lack of access to healthcare. That's one. Okay.
Yeah.
Two, being ignorant to the fact that, hey, you've got a prostate, hey, you've got stuff you've got to take care of, and you're not immortal. Okay. And so,
You're right.
Nate, you know this for a fact. We've had men in our family deal with, succumb to, or had surgery and recover from prostate cancer.
Yeah.
And a lot of the things they say are just off the wall. Okay.
Right.
I've dealt with a lot of African American men in my practice. And even in cases where I knew this person had prostate cancer, and I'm not even joking about it, I know he had it, right?
Right.
And he didn't want to do anything because he heard from a friend about doing a biopsy and how bad that was, you know?
Yeah.
And so there's a lot of situations like that that play a role into why we have worse outcomes, okay? Just
Yeah.
like colon cancer, okay? And just like pancreatic cancer, a lot of African Americans have worse outcomes, and a lot of that has to do with the social and the economic downsides of our community. Okay.
Exactly. That's what we fall short at on a lot of things in our
Yeah.
communities, and that's the say it once again, and as we always say, that's what we're here for, us to inform you. You know what I'm
Right.
saying? Just
Right.
send it
And
to somebody who you can send this to, any one of your friends, share it to them personally, throw it in a inbox. If they look at it, might look at just a little bit, they might learn just a little bit that they do learn, might save their life.
right.
Some of our
Right.
videos are kind of long, you know what I'm saying? But the little bit that they do learn, might just save their life.
And
I
that's
don't
what we're here for.
don't want nobody go through that having to wait for their cancer results to come back. That's not a fun deal.
Yeah. Yeah. It's
Really
scary.
not.
And again, that you catch it early or you take the preventative measures, then you're going to do better. And so, I don't want to just kind of push everybody else out. But the reason we do this, everybody, is not only to inform the world of different health issues that affect us as humans, but we actually want to do a lot of outreach to a lot of people who we know don't get a lot of information about their health. And African Americans, especially African American men, are
For
one of
sure.
them.
For
Okay.
sure. Yeah.
And so, yet again, it's one of those times we all know when we're trying to get screened for prostate cancer, you're going to have to go to the doctor. Get a doctor, black man. It's very important. Okay.
And what kills
Doc,
me, a lot of these cats be having insurance. It kills me, man. A lot of them got some, especially down here where I'm at, man. A lot of these cats out here got some good jobs.
yeah,
They doing pretty damn good for themselves down here.
some of the
Way
best
better than
on
me.
the planet.
Don't want to go to the doctor.
Yeah. Yeah. And it's a pain. Everybody knows it's a pain, but,
Yeah, inconvenience.
yeah, it's an inconvenience, but it'll save your life, guys. It really will, because a little discomfort now leads to a lot less discomfort later. Okay.
Especially us as man, especially the fathers, especially the real fathers. It might be inconvenience for you to go to the doctor. Just imagine, especially the real fathers and husbands. Just imagine if you leave your family from your selfishness, not want to go to the doctor and get yourself checked out, and leave
Right.
your family
Right.
inconvenient. You
Right.
know, I
And I
mean,
want to emphasize something here as we talk about breast cancer, which we'll definitely do again this month a couple of times. But when I say I don't want anybody to downplay this. Okay, even though you don't die as frequently from prostate cancer, there is a lot of suffering that can come from prostate cancer. You ever heard that term? There's a lot of things worse than death. Okay. And so, we've had family members who've had advanced spread metastatic prostate cancer to go to their spinal cord, okay, and going into their bones, breaking their bones slowly but surely over time. Guys, that is a miserable existence. So if you're going to say, hey, Dr. John said, I won't die from this. Yeah, yeah, I said you might not die from it, but I didn't say you could probably walk and feel comfortable either. Okay. I didn't
right.
say you wouldn't have a tube coming out your bladder either. Okay. And so those are a lot of
Right.
things you got to think about. Having a lot of morbidity with a disease is in a lot of ways just as bad as dying from a disease. Okay. A
Yeah,
la
you
COVID.
say the
Just
spinal cord.
COVID shout out there. Okay.
You said the spinal cord deal, man. A lot of I know patients that you can still use your private for a while long as you take care of yourself. You get that prostate cancer, you gotta do certain surgeries. Your brothers know what I'm talking about, man. You be
Right.
paintbrush.
Right.
You erectile dysfunction forever. I use pumps and shit, man. Yeah.
Right. 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 Don't
You know
let
what I
your
mean? Being
menopause
serious,
get to
man.
mess.
You gotta take care of your body. Your
Yes.
body is your thing, man. Your health is your thing, man. Sexual health, all that, especially if you're married.
Yes. And so overall,
I'm sorry.
so as far
Wow.
so
UPS man be coming back every day dropping shit off of your house, man. Your wife, yeah, you at work. I ain't order this again. UPS man be riding to your drive. This was every damn day. Two different drop balls. One gonna get another man. God damn. Mailman and shit. Mailman delivered mail about 5 times. You gonna play with your prostate. And don't die, have to deal with the consequences. I'm just telling the truth.
it's true
I
though.
mean, that's the shit. That's stuff I think about if you're being stupid about it, man.
Right.
And now you stuck here, gonna stay here on Earth. Probably got a fine wife, man. You can't do nothing with her. You gotta go to work
Yeah.
every day because you gotta keep your household. You got all
What
kind
was
of
it?
shit you ain't doing nothing.
In the words of one of my good friends, it was like you gonna be that person that's got 2 Virginia hams in both arms and ain't got no bread at all. Like you ain't got no
No,
bread at all.
you ain't got no mayonnaise working no more.
Ain't got no mayonnaise.
Beer up, man. Got some bread, but it's soggy.
Yeah.
You gotta go to work and make as much money you can, take care of that woman, the people there. And while you gone, Yeah, about 4 or 5.
Yes,
Man, my
everybody.
grandson fell
Here,
asleep. I'm just snoring.
yeah,
Get your
yeah.
butt up, man.
We breaking this down. Virginia hams, everybody. We are breaking this down.
Yeah.
Yeah.
Let's keep rolling, man. We got all off and somebody come by your house after you got empty. Mailman dropping off 5 mailman a day coming by your crib. I forgot to drop this off too, man. How you doing, baby?
But with prostate cancer, it's and the simplest thing to tell you about screening is when do we really start screening for it for the average person is when you're 40. Okay, 40 is the magic number for men, and that's when you'll do a combination of a couple of things. You'll get a blood test called a PSA, which stands for a prostate specific antigen, which basically means a molecule that you can only get from the prostate. The end. Okay, that's why it's called that. And then we do the old finger test. Okay, the hook and ladder, the what we call the digital rectal exam. So rectum being your hind end and digit meaning my finger. Okay. And what we're feeling for in that sense is the back part of the prostate lies against the rectum. So when we go up, okay, we can actually feel for any tumors or any abnormalities that are in that back part of the prostate. Now, does that get the whole prostate? No, but you can feel for abnormalities because what we're trying to feel for is a smooth lump. Okay, if it's bumpy, if it's it should be firm, but if it feels like a stone, that's a problem. Okay, and so there's little things
Wow.
like that we have to feel for, and if any of our audience has ever had it or known somebody to get it, they'll probably say it felt like for 5 hours, but it was really just 5 seconds, and you'd be surprised how much we can get in that short a time. Why? Because we know it's uncomfortable. Okay, and two, a lot of us docs, we really didn't get into the business of going up people's hind end with our fingers. So we're not trying to be up there too, guys. So, and men, just go ahead and get it. Don't complain. Just go ahead and get it because women go through a million times more invasive procedures in their life or more I should say, uncomfortable situations in medicine than we ever will be in. Okay. So just think about your loved ones that are females, your wife, your sister, your mom, and everything. Go get it. It's no big deal. They'll call you a wimp because if you don't do it for that reason, you are a wimp. Just saying. Okay. Now, Nate, we went over it. What's really the other risk factors for prostate cancer? So we said, okay, having bad outcomes if you're African American compared to white, Hispanic, and Asian. Okay, Native
Okay.
American is kind of around the African American mark as well, and a lot of reasons about that is one due to medical literacy. So a lot of studies have said, okay, but two is a lot of things I've already said for the other ones, but it's more in line with the colon cancer risk factors. High animal fats and red meat, low vegetable and fiber intake.
I
Okay.
always go back to that diet
The diet. So the diet is the biggest thing.
with your
And then
body.
what's the main thing I'm going to tell everybody not to do is what? Smoke. Okay. Nicotine usage. No nicotine usage. Okay. Now, is there a super strong link to it? No. But there is a link between inflammation and prostate cancer. So guess what? Nicotine causes inflammation if you keep doing it, no matter what route you take. So, guess what? That inflammation is going to lead to that prostate cancer. There you go. Okay. So, no nicotine use. Okay. Now, some other risk factors, and this isn't set in stone or anything like that. But remember, Nate, with breast cancer, it was the women who waited a long time to have kids, and then
Mhm.
the women who take a lot of hormones, okay, that overexposure or that non use of the breast tissue. Well, there are some links to not having a lot of ejaculations over time. And
Oh
what
shit.
we're saying, not at a lot.
I ain't got that. I ain't got that to worry about. I thought I was finna say ejaculating too much, man. I've been ejaculating since I was about 8 years old, man. What's going on? I thought you been say I got scared for a minute. I was I gotta get checked out, man.
And I want to quantify that, and let me quantify that for a second. We're talking about like essentially not having an ejaculation every day or every other day. Okay, that's what we were talking about. If you're only having like less than 20 ejaculations in an entire month, that's what we're talking about. Okay, now this is not set in stone. I am not saying okay, you need to go out and
Oh man, no, you said it. You
okay,
said it. You said a man can get prostate cancer and die if he ain't getting enough cootie. You
I didn't say
said
that.
it, man.
I didn't say that. I didn't say that. I said ejaculate. I said ejaculate.
Man, what he die from, man?
Okay. I said ejaculate, sir. Sir, there's
I
a lot
got
of
you, man. I'm
ways to
just
do
joking.
that. now,
Oh man.
and I will say this leads into now if you do go out and ejaculate a lot with partners and such, okay, you don't take care of yourself, an actual real risk factor for prostate cancer is what we call prostatitis and STDs or STIs, okay, sexually transmitted illnesses / infections.
Wow.
Okay, so that's a real thing. So much like I said before with the other cancers, remember, Nate, constant inflammation. Okay, so some things can cause a dormant, constant inflammation. One being what we know as trick. Okay, a trick infection that you may not know you have, which is very common for men, right, has been shown to cause chronic prostatitis or prostate inflammation. Okay, it can be
What's the
seen.
full name? What's the full name of that right there?
So trichomonas. Okay, now I'm not going to give you the other
Yeah.
part of it, but that is a sexually transmitted infection, and it has been linked to increased rates of prostate cancer. What else has? HIV. Okay,
Mm.
HIV has been seen more so in HIV positive men. Now, why is that? One, HIV tends to give you a chronic or a long-standing inflammation, no matter if the virus is suppressed or not. Okay,
Wait,
and
no, no,
two,
no, no. Sorry.
and then two, a lot of times with HIV patients, they actually get a lot of direct care. Okay, and so a lot of HIV patients, compared to your regular guy, is actually probably going to be seeing their doctor a lot and probably going to get screened a whole lot more frequently. So that actually may be one of the reasons we see that increases because they have more direct care. Okay, so keep
Right.
that in mind. But the chronic inflammation from sexually transmitted illnesses is a risk factor for prostate cancer. So that's why I said ejaculate, do it safe, do it smart. You go put that in the PSA right there.
Wait, say
Now,
it again.
no,
Somebody
put that in
sneak
the
up behind me.
yeah, put that last part I just did. We can use that as a public service announcement. Okay. The more you know.
Say it again. Oh,
So
okay, yeah.
yeah, I don't know if I can say it again because that was just priceless how I did it. But we'll rewind
Oh, we got it.
it.
We got it. Hold on. We got some
But
questions probably. Yeah. Go ahead, bro. I'm listening.
okay, I thought you were about to give me a question because I actually do have. So I actually was talking to a friend who is a urologist, and I actually asked him, what are some of a lot of the symptoms you're seeing and things like that? Because from a specialist standpoint, and then from my standpoint, it might be two different things, but a lot of it is about the same. And the problem with prostate cancer and really deciphering symptoms from it overlaps with so much other stuff. Okay, and that's a real issue with it. So naturally, if you are a man with testicles and an intact prostate, it's going to grow over time. Okay, it's going to grow, and it's going to gradually start cutting off the bladder from letting you pee. Okay. And so that
Mm.
is a common diagnosis that all men have to some degree. Well, having an issue with urination, like you do with that gradual enlargement of the prostate, can actually be a sign of prostate cancer as well. Okay. Now, I see this question. I tell a lot of men when they say they have problems urinating, first I ask them if they've been riding a lawnmower or anything that you're bouncing, because that can swell the prostate, and tell them to get it checked by a doctor to check for lumps and see if their levels are high. Brilliant. That is fantastic. Okay. Vanessa, that is fantastic, because that's true. Because the prostate rides so low and so close to your hind end, that constant bouncing on your pelvis can transmit energy and force into the prostate. So it can cause a traumatic prostatitis or inflammation. If there is continued pain and things of that nature, yes, a man should get checked out. If anything hurts down there, guys, go to a doctor. Okay, don't just let that slide. Go to a doctor. Okay, and I
Right.
think we say this like every episode, but if something is weird like that, go to a doctor. Okay. Now, Nate, do you want to guess on how some other symptoms of prostate cancer?
Guess.
Yeah, you want to guess some?
Symptoms. Blood in the urine.
Blood in the urine. That is absolutely right. And so that's a good one, because you can have blood in the urine. Yet again, guys, if your urine is all of a sudden very orange, red, or just outright blood, get that checked out. Okay, because that's not supposed to happen. And so that can be from prostate cancer, but that could also be from prostate infection or inflammation, or that actually could be from your bladder as well. So yet again, there's a lot of overlapping stuff there. Okay, and that's why you can't just say, "Oh, all of a sudden it's prostate cancer," or you just disregard it as something else that's not prostate cancer, because there's a lot of overlap. And then along with that, blood in the urine, you can also have blood in your semen. Okay, now, guys, I ain't gotta tell you, if semen comes out any other color than milky white, go to the doctor. If it's yellow, if it's green, if it's bloody, pink is usually the sign of blood in there. Okay, if it comes out pink, if you see that, go to the doctor and get that checked out. Okay, or if you're having erectile dysfunction, or if you're having ejaculations but they don't come out, but you feel like you ejaculated, it could be going into your bladder. That's called retrograde ejaculation. Okay, that needs to get checked out. Go to your doctor. Now, if that does happen, one thing your doctor needs to do, because a lot of these issues can also be a sign of what? Diabetes. Okay, can be a sign of diabetes, because the nerves that coordinate all this can be totally off. And so it's always recommended to get your sugar levels checked. Now, it's, an interesting point in that it could be a double whammy, because having high levels of insulin and what we call the metabolic syndrome of insulin, high insulin levels and insulin resistance with diabetes, can cause or be a risk factor for prostate cancer. Okay. So, yet again, this goes into, guys, take care of yourself. Okay. Do what's best for your body. Don't overdo it with everything all the time. Okay. Now, I'm saying all this and I'm not trying to be doom and gloom. I'm just trying to educate. So, on the flip side, what do we need to do to prevent this? One, get a doctor, get a primary care doctor ASAP if you don't have one. Two, ask questions to your primary care doctor. Three, have more vegetables and fiber in your diet. Men should be getting at least 28 to 30 grams of fiber a day. Get it from vegetables, okay? Reduce the amount of animal fat you have in your system, okay? And in your diet. That will help. Now, one thing I do want to address because there are some studies that are conflicting, and some people have asked me recently about some holistic things to prevent cancer. So there's one thing called lycopene, okay, and that is a product that you mainly find in a high concentration in tomatoes. Okay, it gives it that reddish color that has some links to not reducing, people who have had high levels of that in their system, who have a lot of that in their diet, have been shown to have a lessened chance of prostate cancer compared to people who don't. There's not a true definitive why that happens, but that is an association we've seen. We just don't understand it yet. Another thing, you hear about, you know what you hear about with oysters, Nate? Eat the oysters and you'll become potent and fertile and stuff like that. And the reason is because oysters have a good level of vitamin E in it, which is a very important vitamin that actually protects a lot of things in your body. And there's a thought that it could help prevent prostate cancer, but there has been nothing definitive showing that. And then in some studies, it actually shows the opposite. So you can't really say that's a big protective mechanism. Same thing with two other things, selenium and zinc, two minerals that are actually involved and put in seminal fluid, is important for cell maturation with your sperm and things of that nature. There's been no positive, super concrete link between that and reducing cancer risk. And then also turmeric and omega-3 fatty acids. There's a thought that since they're anti-inflammatory, which they are, that they prevent prostate cancer. There's nothing decisive or something on a mass scale saying that. And so we can't necessarily say, hey, go ahead and take it. It'll stop you from getting prostate cancer. But what I will say on all those, if you have a balanced diet with all those, and if you increase your vegetable intake, decrease that animal fat intake, then you get more omega-3s and those those fatty acids you get from fish in your diet. If you actually go down on the red meat, you'll get more vegetables and fiber, and therefore you get more natural probiotics that'll give you a lot of those minerals and nutrients and things of that nature. So that is one thing to really keep in mind: is a balanced diet is the best natural medicine. Okay. Now Vanessa is asking, what about a alkaline diet? So that that is an area. So I could do a whole show on that. Okay, having an alkaline diet meaning you're having a balance of certain foods and water and things of that nature to keep your pH at a good system as far as where you are in your body, in your blood pH. Saying it's an alkaline, saying it's going to make your body more alkaline is a little of a misnomer because your body regulates that pretty hard, and everything you intake goes into battery acid. And so whatever it's going to do, it's going to do. Even if you take calcium, you're still going into battery acid. Are there health benefits from an alkaline diet? Yes. And a lot of times when people do these types of diets, it's because you're taking a lot of negative stuff out of your diet, replacing it with the stuff that's in these diets that tend to be healthier. And that's where you're getting the true benefit for it. Not just saying, okay, keto is better than alkaline is better than vegan's better than Mediterranean. So a lot of that is balancing what you're taking in and getting the right stuff in and getting the bad stuff out. And I think getting the bad stuff out is actually a little bit more important at this point, if that makes sense.
Right.
Okay. That's a really good
Right.
question, and we could probably do a show on different diet types and such. But that's a really
Mhm.
good question. Now, am I going to say people shouldn't do an alkaline diet? No, because it's better than the regular American diet by far. Okay, by far. Have you ever heard of that, Nate?
What's that? The alkaline diet?
Yeah,
Yeah. Yeah.
yeah, and it's super. And yet again, it's not. It's not the most trendy thing, but it's getting it up in popularity now. Um, and it's yet again, it's a good diet. And a lot of times, yet again, I'll say this again, it's because you take a lot of bad stuff out of the stuff you're already doing prior to starting that alkaline diet. So if you're doing it right now, Vanessa, or you're telling people to do it, tell them to do it. Because a lot of times, if they get rid of all the sodas and the pops and the drinking excessively and smoking and nicotine or just nicotine in general and all that, do it. Okay. If it increases your fiber intake and all that other good stuff, do it. Okay. Just don't
I,
overdo
I had
diets.
I
Go
had a
ahead.
book on African ancient African diet, and it copied some of it copied a lot of the alkaline diet.
Hmm. Yeah, and
You know, the
you know,
original.
Doctor, what was his name? Doctor Sebi. The
So yeah,
yeah,
thinking about.
his diet was pretty much the alkaline diet, and his was actually a very balanced mix of like fruits and vegetables, things of that nature. And it was the same. And his diet actually was the principle of decreasing what he said mucus, which essentially is just inflammation. So
Right.
decreasing the inflammation in your system, and that's a good way to go. The Mediterranean diet has shown all kind of benefits against all kind of cancers because it is less inflammatory than a lot of other diets. Okay. So
Mm,
if you go on like say the paleo diet or or the old, you remember the Atkins diet when that got big in the early 2000s, people were losing weight, but they were still having heart attacks and stuff because they were just replacing it with steaks and hamburgers without the bread and stuff like that. And so
right.
you still have to look at what you take in overall. She
Right.
says I usually tell people to eat like a 60% alkaline just to balance their bodies, which is fine. That is totally good. Yeah, and keep telling them to do it because a lot of times that's usually 10,000 times better than what they're doing. So keep telling people that because that's a good thing because you could really be
So
helping people and saving people's lives.
for real.
You know.
Yeah.
Now, other than now, getting back to the prostate cancer thing, as far as and yet again, I want to save the in-depth metastasis treatment and stuff for November since that's male health month, so we can go into more
Okay.
detail there. I just am trying to emphasize symptoms, signs, things you need to talk to with your doctor, things of that nature. And so, guys,
So
if you have a lot of sexual dysfunction, I want to emphasize that again. If there's blood in your semen, blood in your urine, you're not able to urinate well, or if the stream of your urine is not arcing as well or not coming out with as much force as it should or it used to that you recognize, go to your doc and talk to them about it. Go to them and talk to them about it. Okay? Because those are things that need to be evaluated. Now, 9 times out of 10, it'll be just regular prostate enlargement, but you need to make sure you're not that 1 out of 10. Okay, because when you disregard stuff and you put it in the back burner and things of that nature, if you're going to the bathroom 8 times a night and things of that nature, okay, which is another sign of prostate enlargement or a tumor pushing on your bladder, okay, then that's how we find ourselves, okay, well, this started when I was 40, but damn, I'm 55 now, and all of a sudden I've got a tumor that's lodged into my spine. Okay. And that's what happens a lot of times. That could put you in a really bad spot, guys. So that's why I'm emphasizing not only to just men in general, but African American men. When we talk about prostate cancer and getting checked and everything, let your pride go. Let these stupid,
put that light on. Right
like I feel like I'm a homosexual if I
here.
let a doctor put his finger up my butt and stuff like that. Like I don't want to do all that. Let all that go. Let all that go. Okay? Because yeah, it's your health. Don't be stupid. It's your health. It's your body. You only got one. You don't want to be miserable for the last days of your life. And yet again, Yeah, the females that you know in your life have gone through 8 billion times worse than what we will ever go through when it comes to basic health care. Okay, so you can deal with it. You can handle it. All right. And Nate, I know you see this all the time. Who be the worst people to do IVs on, to give shots, to do procedures? Is men, right?
Mm-hmm.
And there's men out there know
Seems
what
like
I'm
it'll be
talking
easy.
about. You know,
Mm-hmm.
they
Yeah.
be the worst ones. The funniest one I ever had, I was trying to do sew up a wound on a guy's hand. And this guy was like, yeah, man, I got shot before and I walked away from it. And I got in a car accident. I walked away from it, so it's no big deal. And he's sitting there before I even put the needle, like before I even had the cap off the needle to numb it up.
Yeah.
He's just like, and I'm like, and I put it in his face. I was like, bro, this thing is about 2 feet away from your hand. What's wrong with you? Right? What's wrong with you?
You was doing an IV?
No, I wasn't doing it. I was just putting lidocaine in.
Right. I was doing a correction. I had a correctional assignment out there with those tough guys, man. I pulled a needle out on one of them. He was doing kind of the same thing, about to flip out, start sweating and everything, man. So tough ass, man. He locked up in. Hey, Vanessa got another comment right here. I'm loving Vanessa today.
Yeah, Vanessa's coming with it. I love it. No, can men feel for lumps in their prostate like women check their breasts? So no. That the only area where a guy could possibly do it, and yet again, you're talking about a lot of different factors that would play in that. Whereas the breasts are anatomically always there, protruding out on an open field of the chest. The prostate is a walnut and it's kind of tucked away. So if a man were feeling like under his testicles, okay, and going to the skin and going down, he may feel a little lump or so. But that's really not accurate. And a lot of men don't even know what they're feeling at that point. So that's not a good route to tell men to do. That's why we haven't told men really to do that, because it's not the most accurate thing. That's if a guy could actually do that, because if guys are very obese, or yet again, guys don't even know what they're feeling for half the time. Okay. As opposed to a lot of women who are more in tune with their bodies. Now, yet again, if the man is in a relationship and during sexual intercourse, there's some, what would you call it, analingus? If his partner wants to do like a digital rectal exam for pleasure, might feel something. Something might feel a little bit different. Much like for breast cancer, a lot of times partners will notice that there's a lump or something, or some abnormality in the texture of the breast, and it's the same thing there. So that would be one way to kind of do it at home. But yet again, you have to know what you're actually, feeling for. And
that's why I think she was asking. That's why I kind of think she was asking about it, because that's the only way she could have meant it. Because it's a good question though. I mean, how the world is. Couples out here the same sex. You got to deal with it. Doctors got to deal with it. We got to deal with this nurse. I mean, it is what it is.
If a guy is flexible,
hard people
enough,
too.
Yeah, because you would really have to get to that.
I'm not doing myself like that.
Yeah, because you would have to get to about the second knuckle line to feel it.
You put shit on your damn finger before you get it.
Right.
Nah, it's not happening, man.
Yeah, and yet again, most men would not know what they're for anyway. And really what we do as doctors, we kind of come in, lube up the finger and kind of come in and slide up, and we're going on this floor, and the prostate is right here. We'll be right here. So we're kind of sliding through, trying to feel for lumps right there. Okay. And so if men were anatomically trained and knew what they were doing, we probably encourage men to do it, but we know most men aren't going to do it. Yeah, unfortunately.
Yeah, it's crazy, but We
No,
have to get this stuff out here so people can learn about
yeah.
this.
Now,
Okay, we said you talk about all the other stuff on the next one. You don't
yeah,
get too in depth with this because
and then,
it goes deep. This prostate information goes deep, man. We had
yeah,
almost an hour now, and we got about another hour to do if we was to stay on it.
right, all
It's
right,
definitely
and
learn everything about it.
and
It's
then
crazy.
I would like to say, and I'll throw this out because I actually did get some Facebook feedback or actually questions, and there is this one myth I want to debunk for all these cancers. Um, when you get surgery for cancer, whether it be prostate, breast, colon, pancreatic, liver, whatever, brain, whatever, exposing cancerous tissue or a tumor to air does not make that tumor grow.
That's
Okay.
the biggest myth in the dang on hood. That's the biggest
Yeah.
one. You know when they
You
open you up, you're gonna spray it anyway.
right,
I used to hear that as a kid. You know,
right.
you
And
know they
what
cut them open and start spreading.
yeah, because and you'll hear it, it's like, yeah, then all of a sudden the cancer was everywhere. And it's like, guys, the reason why the cancer has spread after the surgery is because it had already spread before the surgery. We just didn't see it all. Okay.
Right.
And so that's what you've got to realize. All cancers, what they require is blood and nutrition that's in the blood. That's all they need. Okay. And you've got cells in your body that are natural cancer fighters, but sometimes it just don't work. Okay, your Coast Guard and your FBI just don't work, and it overruns it, and that's when it starts growing and growing and growing. Has nothing to do whether it's exposed to air or not, because on that logic, then cancer would not exist because you're at that point saying cancer needs air to survive in a state that we need it. Like we inhale it in and put it in our blood. So you're saying the cancer requires a high volume of air at a certain pressure that's like the atmosphere to grow. Guys, if that was the case, we wouldn't be having this show right now. We wouldn't be having this conversation. The prostate is actually encapsulated within a capsule. It's so hard for stuff to get in there. The stuff that gets in the prostate is the stuff that's the only stuff that's able to get in. Okay, there is an actual barrier to where a lot of parts of things in your body can't even get in. Same thing with your brain, and actually certain parts of your breast. There's actually parts where it's hard for stuff to penetrate into. So if that was the case, and you needed air, those your prostate probably has the least amount of air. Like you can't walk into your prostate and breathe. Like no, there's no air. The only air is the molecules of oxygen that are in the blood, and that's what it's feeding off of. It requires that. It doesn't like, oh good, I'm out and about. Oh, the surgeon done opened me up. Took a big old breath of life. No, that's not how it works, guys. Okay? So I want to debunk that myth because it just is not true. Okay, and that's another reason which leads to people saying no, I don't want the biopsy, no, I don't want surgery to help the cancer out because of stuff like that. Okay, don't think it's us creating stuff or causing stuff to propagate. It's stuff we're finding. You hire us to be treasure hunters, okay? And if we find something, don't think we planted the stuff, okay? Because at the end of the day, if I find cancer in somebody, okay, from a purely human selfish thing, two things. One, I get upset because that person has cancer, and me as a human being, I'm going to feel for you. I'm going to be upset because I grew a relationship with you. So I'm going to be sad. And then two, right, that makes my job harder. Nobody wants to work super hard, right? It makes my job
Right.
harder. Okay, if you think a surgeon gets paid more money because he finds more cancer, you're out your mind. It just makes his surgery much longer, and then he's like, damn, we got all this. Damn it. Okay, that makes your job harder. Okay, so
Right.
from a purely selfish reason, from that which is down on the rung, just the most doctors have that. It's just like, damn it, I wish everybody was perfectly healthy. Okay, Wish they were just perfectly healthy. But no, we got the cancer, we're going to deal with it. Okay? So, Black people, get screened, get to a doctor, Black men especially.
Please.
Get to a doctor, have a yearly exam, have checks, get your blood levels done, and just do it because it could save you so much heartache and misery. Okay? And misery is for real. And that's it for me, bro.
Oh yeah. Man, we sure appreciate y'all stopping by, checking everything out. Y'all can go like the page. Really appreciate y'all. And man, that is it for us.
And also stay healthy.
That is it for us. Peace.